We are going today to discuss fungal infections and the most common antifungal medications used to treat either superficial or deep fungal infection. At first, fungal infections are most common infections occur in patients, especially in immunocompromised patients, either due to suppression of immunity in patients with HIV infection, AIDS patients, or patient taking corticosteroids after organ transplantation, as corticosteroids known as immunosuppressant medications. So with the weakness of the immune system, the fungal infection can occur easily. Also, fungal infections can occur after the use of invasive instruments like urinary catheters. Before we start talking about the antifungal drugs, we have to know the types of fungal infections. Let's start with the type of fungal infection. Fungal infections can occur in any organ in our system, can affect mainly skin and the mucous membrane or affecting deep organs. When the fungal infection affecting skin or mucous membrane, this is called the superficial fungal infections. And when it affects the deep organs, it causes deep fungal infection. So superficial fungal infection, this is due to infection of skin and mucous membrane. When the infection is caused by dermatophytes, it mainly affects the skin, and when it caused by candida, it will affect mainly the mucous membrane. The dermatophytes known as tinea. Tinea can occur mainly in the skin in any type of or any part of the body, in the skin of any part of our body. So when it will affect the scalp, it causes what is called the tinea capitis. It was a clinical picture of well-circumscribed area of hair loss covered with many scales. This is called the tinea capitis. When the tinea affecting the body, it causes a well-circumscribed rash with well-defined border, and this is called the tinea corporis. In nails, cause a clinical picture of what is called the onychomycosis. The nail is thickened, yellowish in color, and it also affects the food, the athletic food. It occurs with exercise and sweat secretion. It causes maceration of the toe webs and the infection of the foot. This is called the athletic foot or tinea pedis. The candida mainly affect the mucous membrane, like vaginal mucous membrane, oropharyngeal, GIT, and also can affect the skin alone or the mucosa and the skin, mucocutaneous lesion. In severely immunocompromised patients, the candida can spread to deep organs, cause deep fungal infection. The fungal infection in any organ, like lung, cause fungal pneumonia. GIT, fungal gastroenteritis. Cardiovascular system, heart, fungal endocarditis, and fungal meningitis. We are going now to classify the antifungal drugs. The antifungal drugs can be classified into drugs used to treat superficial fungal infection and drugs used to treat deep fungal infection. For superficial fungal infection, either dermatophytes or candida, and for deep fungal infection, the deep fungal infection of any organ. Okay, when we trying to treat the deep fungal infection, we have to use systemic medications. Drugs reach the systemic circulation and used to eradicate fungal infection in the deep organs. While when we try to treat superficial fungal infection, we can at first use the topical medication, drugs used topically either on skin and mucous membrane to treat fungal infection. If these drugs fail to treat superficial fungal infection, we can use the systemic treatment. But from the start, to treat the deep fungal infection, we have to use systemic medications from the start. For deep fungal infection, we use Amphotericin B, flucytosine, azoles, and the caspofungin. So, drugs used to treat deep fungal infections are Amphotericin B, flucytosine, azoles, and caspofungin. For azoles, azoles are broad-spectrum antifungal drugs like Joker used for any fungal infection, either superficial or deep fungal infection. Azoles are present in many routes, topical and systemically. So when we use azoles for systemic treatment in deep fungal infection, sure, we will use the azoles that are safe to be used systemically, like fluconazole, itraconazole, and voriconazole. In comparison with azoles that can be used topically, for azoles used topically, we can use the toxic azoles as they will not absorb it in the systemic circulation, so can be used topically. So there are many different members of azoles used for treatment of the topical or for superficial fungal infection. For treatment of superficial fungal infection, we can use either topical treatment, drugs applied locally or topically, either on skin or mucous membrane. If these drugs failed to eradicate fungal infection, we can shift to systemic treatment. But in deep fungal infection, we start with systemic treatment from the start. For superficial fungal infection, systemic treatment, we can use also azoles, as azoles like Joker, broad spectrum antifungal drugs used by many routes. Okay, azoles are used for dermatophytes and candida as they are broad spectrum. Graziofulvine and turbinafine. Graziofulvine and turbinafine. Graziofulvine and turbinafine used for dermatophytes or tinea. Okay, for topical treatment we can use also azoles, as azoles are broad spectrum antifungal, but we use azoles that are systemically toxic for systemic use. So these azoles are used topically only. So the azoles which are toxic for systemic use and used topically only are ketoconazole, miconazole, and clotrimazole. So again, what are the differences between different members of azoles like fluconazole and ketoconazole? Fluconazole safe for systemic use, so can be used systemically, either in deep fungal infection, or used systemically for superficial fungal infection, can be used systemically, can reach systemic circulation and can reach different organs, safe to be used systemically. While ketoconazole is very toxic, not used systemically, so only used topically in superficial fungal infection. Other drugs used as topical or local treatment for superficial fungal infection are turbinafine and statin. Turbinafine, like this, turbinafine also for tinea and can be used topically, and statin for candida and can be used topically. So, to summarize, azoles are broad spectrum antifungal used systemically, either for deep fungal infection or systemically for superficial fungal infection, and also azoles can be used topically for superficial fungal infection. For deep fungal infection, other drugs rather than azoles are Amphotericin B, Cytosine, and caspofungin, while for systemic treatment in superficial fungal infection, turbinafine and graziofulvine, systemically for dermatophytes or tinea, and topically are turbinafine and statin. Turbinafine used topically for dermatophytes or tinea, and statin for candida. So when I ask you what are the uses of turbinafine, turbinafine is an antifungal drug used to eradicate dermatophyte or tinea, used both systemically and topically. Okay, what about graziofulvine? Graziofulvine is an antifungal drug used for tinea and used systemically, not topically. What is the use of statin? Statin is a topical drug used for eradication of candida. What are azoles? Azoles are broad spectrum antifungal. Azoles for toxic for systemic use are ketoconazole, miconazole, clotrimazole, and these azoles are used for superficial fungal infection topically. While azoles can be used safely for systemic use are fluconazole, itraconazole, and voriconazole. Okay, so To summarize again, the management of fungal infection, antifungal drugs, either superficial or deep, Amphotericin B, Cytosine, azoles, safe azoles, and caspofungin, and for superficial fungal infection, dermatophytes and candida, either topically like azoles, ketoconazole, miconazole, clotrimazole, turbinafine and statin. Turbinafine and azoles also used systemically for superficial fungal infection, and graziofulvine for tinea. Graziofulvine for tinea, turbinafine for tinea, azoles, broad spectrum. The only drug used for candida is nystatin. So if we need to treat candidal infection, we can use nystatin topically or azoles systemically. When we use or we want to eradicate the dermatophyte, we can use azoles systemically, turbinafine, graziofulvine systemically, also turbinafine and azoles topically. So all these drugs are for tinea. Only nystatin is for candida, and the azoles are broad spectrum. When we need to eradicate superficial fungal infection, we will start first with topical agents. Then, if failed, we shift to systemic therapy. But systemic therapy can be used from the start if there is a wide or inaccessible area like back, in severely infected persons and severely infected organs like hair, nail, and the skin, and in severely immunocompromised patient, we have to use the systemic therapy from the start. Mechanism of action of the antiviral drugs. The fungus has an outer cell wall, then an inner cell membrane. The inner cell membrane is formed of ergosterol. Steps of formation of ergosterol is very, very important. The ergosterol in the cell membrane is formed of a substance called squalene. Squalene, by an enzyme called squalene epoxidase, is converted into another substance called lanosterol. And the lanosterol, by an enzyme called cytochrome P 450 dependent 14-alpha demethylase. 14-alpha demethylase is one of the members of cytochrome B 450. The lanosterol by this enzyme is converted into ergosterol, which is entered in the formation of the cell membrane. Like any cell, the fungus has a nucleic acid and has the microtubules which help in mitosis and cell division. The cell wall is inhabited by a group of drugs called the echinocandins, like caspofungin. Inhabitants of cell wall, echinocandins like caspofungin. The cell membrane is inhabited by many drugs. The first drug is the turbinafine. Turbinafine inhibits the squalene epoxidase enzyme. Azoles inhibit the 14-alpha demethylase, which convert the lanosterol into ergosterol. And another group of drugs called the polines. Polines like amphotericin B and nystatin. These drugs making artificial pores in the cell membrane, leads to the leakage of the important cellular structures and leads to the destruction of the fungal cell. The nucleic acid is inhibited by a drug called the Cytosine, and the microtubules inhibited by graziofulvine. So, caspofungin acts like cell wall synthesis inhibitor. Turbinafine, azoles, polines are cell membrane inhibitors. Cytosine is nucleic acid inhibitor and graziofulvine is microtubules inhibitor. We are going now to discuss each drug separately. The first drug is the amphotericin B. From the previous slides, amphotericin B is used to treat which type of fungal infection, superficial or deep? Deep fungal infection. That's true. And also amphotericin B acts by which of the following or which of the mechanisms to inhibit the fungal cell replication. Amphotericin B is the member of pollines, which cause artificial pores in the cell membrane, acts like cell membrane inhibitor. So the amphotericin B first is the most important drug in deep fungal infection and is one of the pollines. Pollines binds to the ergosterol in the plasma membrane, forming artificial pores or a channel that leads to destruction of the cell membrane and leakage of the important cellular structures and electrolytes, and finally the cell death. Amphotericin B is used in deep fungal infection, in severe life-threatening infection. Amphotericin B is a very hydrophilic agent or hydrophilic drug, so when when it is administered orally, it will not pass the blood-brain barrier, okay, or not absorbed orally. So in severe life-threatening condition, the drug should used intravenously, as it is very hydrophilic and not absorbed orally. Also, in case of fungal meningitis, as it is a hydrophilic agent, it will not cross the blood-brain barrier. So in case of meningitis, the drug should be administered intrathecal, directly into the subarachnoid space in the CSF, as if it is administered orally or even intravenous. In case of meningitis, it will not, if it taken orally, not absorbed, and if it taken intravenous, it will not cross the blood-brain barrier. This is a picture for the intrathecal administration. When the amphotericin B is administered intravenous, cause histamine release, and this is causing flushing of the patient, fever, hypotension due to vasodilatation, and shock. And if it is administered intrathecal, it will lead to convulsions. So how to avoid the histamine release, the patient should be administered the amphotericin B slowly intravenous and should be treated before the infusion with antihistaminic. The drug is very hydrophilic, so the main route of elimination is the kidney, and it's very nephrotoxic, lead to destruction or decrease the production of erythropoietin hormone, and this lead to anemia. Also, it will lead to the loss of potassium in urine, and the resulting hypokalemia will lead to cardiac arrhythmias. In an attempt to decrease the adverse effects of amphotericin, there is another formulation of amphotericin called the liposomal amphotericin. The liposomal amphotericin, the amphotericin B is prepared within an artificial lipid bilayer. This lipid bilayer called the liposome. The liposome containing the amphotericin B drug in small concentrations, and the liposome has the ability to fuse only with the fungally infected cell, delivering the drug in minimum concentration, thus decreasing the adverse effect expected from the amphotericin B. So it will decrease the renal adverse effect, the nephrotoxic effect of amphotericin B, and the infusion adverse effect, as it is administered in very small dose. But the main disadvantage of the liposomal amphotericin is the high cost, so it is reserved for patients who cannot tolerate the conventional amphotericin B. The second drug is flucytosine. Remember, the flucytosine used for superficial or deep fungal infection. Yes, this is true. Flucytosine with amphotericin B is used to eradicate the deep fungal infection. And what was the mechanism of action of flucytosine? That's true. The flucytosine is used to inhibit the nucleic acid inside the fungal cell. Just to revise, flucytosine. The drug converted to another compounds like 5-fluorouracil, which acts by inhibition of nucleic acid of the fungal cell. Flucytosine is used in deep fungal infection commonly in combination with amphotericin B, and this is an important and famous drug combination in pharmacology and in medicine, flucytosine plus amphotericin B. Why? At first, flucytosine will decrease the amphotericin B nephrotoxicity, as when they are used together, they potentiate each other. I can use a minimal dose of flucytosine plus minimal dose of amphotericin B. So, by decreasing the dose of amphotericin B, this will decrease the amphotericin B nephrotoxicity. and also they potentiate the action of each other. How? The amphotericin B will act on the cell membrane, causing artificial pores, helping the flow cytosine to enter inside the fungal cell and disrupting the fungal nucleic acid. So this is one of the examples of the synergistic drug combinations. So the indications of flow cytosine is given orally with amphotericin B in the fungal infection like cryptococcal meningitis and disseminated candida, and the adverse effect like any drug inhibiting the nucleic acid, like any cytotoxic drug inhibiting the nucleic acid, it causes the advantage of the famous drugs like anti-cancer drugs, which acting by inhibition of replication of nucleic acid. It will inhibit the mitosis and replication of active replicating cells like GIT, causing enterocolitis, like bone marrow, causing bone marrow depression, like hair, causing hair loss or alopecia, and it is a hepatotoxic drug. The third drug is the caspofungin. The caspofungin used only in deep fungal infection and acts by which of the previous mechanisms. Caspofungin inhibiting the cell wall of the fungus. That's true. It inhibits the synthesis of glucan. The glucan is the main important component in the synthesis of cell wall of the fungus, leading to inhibition of the cell wall and lysis and cell death. It is given in deep fungal infection. It's given intravenous. It's a well-tolerated drug. Absorb it, then cause GIT upset, and when it is administered rapid intravenous, it causes flushing. And this is one also of the most expensive drugs used in fungal infections. Most important antifungal drugs, azoles. Azoles used for superficial or deep fungal infection. Azoles like Joker, broad spectrum antifungal used topically and systemically in both superficial and deep fungal infection. The first member of azoles was the ketoconazole. The ketoconazole is very toxic agent, not used systemically anymore, and it is used only in the anti-dandruff shampoo, topically as shampoo for elimination and treatment of dandruff that's caused by fungi, and also in the form of creams or ointments. Shampoo, creams, and ointments only topically, too toxic for systemic use. While other azoles that are safe and less toxic for systemic use that can be used systemically either for superficial and deep fungal infection are the fluconazole and itraconazole. Fluconazole and itraconazole. Fluconazole like the Flucan and itraconazole like Itrapix and Sporanox. As we said, azoles acting by inhibition of the one of the members of cytochrome B450 is the 14 alpha demethylase enzyme. By inhibition of 14 alpha demethylase, the lanosterol cannot be converted into ergosterol, and this lead to inhibition of the cell membrane formation in the fungal cell. Adverse effect of the first member ketoconazole, and this is not used anymore, only used topically like creams, ointments, and shampoos. The common adverse effects are nausea, vomiting, and rash. The serious adverse effect is hepatotoxic, and the most important adverse effect is the inhibition of human cytochrome B450. It cannot be differentiated between the human and the fungal cytochrome B450. So, or as it inhibits the fungal cytochrome P450 or 14 alpha demethylase, it will inhibit this enzyme also in human, leading to serious complications. First, this leads to inhibition of the metabolism of certain drugs metabolized by this enzyme, and this will lead to elevation of the serum level, so acts like enzyme inhibitor, and this leads to serious drug interactions. And will inhibit this enzyme. The enzyme is used in synthesis of steroid hormones in our bodies. So it will decrease the steroid hormone synthesis. What are the steroid hormones? Steroid hormones are the corticosteroids, the testosterone, and female sex hormones. When the corticosteroids are decreased, this will lead to adrenal suppression. When the testosterone is decreased, it will lead to gynecomastia and erectile dysfunction in males. When the female sex hormones decrease, it will lead to menstrual irregularities and fertility. So it is not used anymore, as it cannot be differentiated between the fungal and the human cytochrome B450, leading to either enzyme inhibition and decrease the formation of steroid hormones, as this enzyme is important in steroid hormone synthesis. So the other members which are safe, sure, they will attack only the fungal cytochrome B450, not the human. They are selective for the fungal cytochrome B450, not on human. So these drugs like fluconazole and itraconazole can be used safely systemically, superficial antifungal infection, as it targets, or they target only the fungal enzyme, not the human enzyme. As I said, itraconazole and fluconazole are specific for fungal cytochrome more than human cytochrome, so they are more safe, they are less toxic, less hepatotoxicity, less drug interaction, and less effect on steroid hormone, either corticosteroid or male and female sex hormones. And they also are more effective. Fluconazole can be given orally or intravenous. About the kinetic of fluconazole, it can reach the CSF very rapidly and can be used in fungal meningitis. It is used as single dose, only single dose. So it will increase the patient compliance, and the absorption is better than the itraconazole, as it doesn't depend on the acidity of the stomach, can be combined safely with drugs that decrease the acidity of the stomach, like antacids and H2 blockers. Okay, we will discuss now the itraconazole. The itraconazole, depending on the acidity for absorption, so cannot be taken with drugs that decrease acidity of the stomach, like antacids and H2 blockers. Most important point in fluconazole, as it is a single dose, only one capsule. Okay, single dose, so it will increase the patient compliance. Adverse effect like any azole, but less than ketoconazole: nausea, vomiting, rash, and hepatotoxicity. The itraconazole is given orally. The itraconazole depending on gastric acidity for absorption. So gastric acidity increase itraconazole absorption, so cannot be combined with antacids or H2 blockers. It will decrease its absorption. Adverse effects like any azoles, but with variable degree, less than ketoconazole. Also, it will cause nausea, vomiting, rash, and hepatotoxicity. Graziofulvine. Graziofulvine is used for superficial or deep fungal infection. Graziofulvine used for superficial fungal infection. Which type? Tinea or Candida? Short, used for tinea, as only statin used for Candida. Okay, graziofulvine act by which of the following or of the previous mechanisms? Graziofulvine inhibit the microtubules. Graziofulvine, the absorption of graziofulvine, the graziofulvine drug is taken orally, and the absorption depending on the presence of fat. When the patient is given a high-fat diet, the absorption of graziofulvine will increase. So it's commonly given in children with tinea capitis or fungal infection with a cup of full cream milk, or with yogurt, or with ice cream, any diet containing high fat, as the fat diet increases its absorption. Even chocolate, anything contain high fat. Okay, the graziofulvine act by inhibition of mitotic spindle, so inhibit the fungal mitosis. And the adverse effect, important adverse effect, is the enzyme induction. Graziofulvine acts as enzyme inducer, and this leads to many adverse effects, and also it is hepatotoxic and cause headache and mental confusion. Turbinafine, used for tinea or dermatophytes, and is present in two formulations, either orally and topically. It's used topically and systemically for tinea or for dermatophytes. Turbinafine inhibits the cell membrane by inhibition of squalene epoxidase enzyme. so inhibiting the cell membrane of the fungus. So turbinafine, in comparison to azoles, it's very safe, as our body doesn't contain the squalene epoxidase enzyme like cytochrome B450, so it is very safe when it is used in patients with fungal infection, as we are devoid of the squalene epoxidase enzyme, not like azoles that target the cytochrome that is present also in our body. So this is very helpful drug, very safe drug in treatment of the drug number one in treatment of tinea or dermatophytes. And first, it is used in many formulations, either oral or topical, and it is very safe in comparison to azoles. Okay. The advantage over azoles: squalene epoxidase enzyme is not present in our body, and so there is no drug interaction with cytochrome B450 like azoles. And the advantage of graziofulvene is more effective and shorter duration of action. So it is now the first line drug for treatment of dermatophytes or tinea infection. Adverse effects well tolerated, just GIT adverse effect like diarrhea and taste disturbance, unlike azoles. The adverse effects are well tolerated. Finally, statin. Statin is a member of pollines like Amphotericin B, and the pollines act by disruption of the cell membrane by formation of artificial pores. Statin, as I said, is used, the only drug used for candida, and is used topically. As amphotericin, like any member of pollines, pollines are very hydrophilic when taken orally, not absorbed, so it is taken topically. Okay, locally, it's used topically or locally. It's too toxic for systemic use. It's very nephrotoxic like Amphotericin B. It's used mainly to eradicate candida, and candida cause mainly mucous membrane infection like oropharyngeal candidiasis. The oropharyngeal candidiasis is very common with patients inhaling corticosteroid inhalers for treatment of bronchial asthma. Most common adverse effect for inhaled corticosteroids are the oropharyngeal candidiasis due to immune suppression, due to flourishing of fungal infection in the oropharyngeal mucosa. This can be treated with statin topically as oral paint. Also can be used for cutaneous candida like topical creams or ointments, and used for fungal candida. In fungal candida, we can use statin topically applied to the vagina to eradicate vagina, and also orally, as the main source of vaginal candida is the gastrointestinal candida. So I have to eradicate also the gastrointestinal candida. Statin is taken orally but act locally. In GIT, it is not absorbed. So by taking statin orally, it acts topically in GIT, eradicating candida, so eradicating the main source of vaginal infection. So in vaginal infection, we use statin topically in vagina and topically in GIT by taking the drug orally to eradicate the source of infection. Thank you.